Do you know what a stroke is? Have you ever pondered about its symptoms and effects? In the next few minutes, we'll be exploring strokes, a medical condition that can have severe consequences if not handled promptly and correctly. A stroke occurs when the blood supply to a part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Understanding strokes is of paramount importance. Why, you may ask? Because strokes are a leading cause of death and disability worldwide. Recognizing the signs early can make all the difference in the outcome, as swift action is key to minimizing damage and complications. We'll delve into the details, from defining what a stroke is, to identifying its symptoms, and even discussing the crucial response method known as FAST. So if you're ready to learn, stay tuned. It's time to dive deeper into the world of strokes and their symptoms. So, what exactly is a stroke? You may have heard the term before, but do you know what it really means? Let's break it down. A stroke is a medical emergency that occurs when the blood flow to a part of your brain is cut off. Now, why is this a problem? Well, your brain is like the command center of your body, sending signals and instructions to all parts. To do all that, it needs a constant supply of oxygen and nutrients, which it gets from the blood. When the blood flow to a part of the brain is cut off, that part of the brain can't get the oxygen and nutrients it needs. This lack of blood supply causes brain cells in that area to be deprived of oxygen, and they start to die. And when brain cells die, the area of the body they control can't function properly. This can happen in two main ways. The first is called an ischemic stroke, and it's the most common type. This occurs when a blood vessel supplying the brain gets blocked, often by a blood clot. The second type is a hemorrhagic stroke, which happens when a blood vessel in the brain bursts, causing bleeding in the surrounding brain tissue. The effects of a stroke depend on where in the brain it occurs and how much of the brain is damaged. For some people, a stroke can result in minor problems that they recover from quickly, but for others it can cause serious long-term disabilities or even be fatal. It's important to remember that every second counts when dealing with a stroke. The quicker a person gets medical attention, the better their chances of survival and recovery. That's why it's so crucial to know the signs and symptoms of a stroke, which we'll get into in the next scene. Now that we understand what a stroke is, how can we identify one? Stay tuned because knowledge is power, and this power could save a life. Identifying a stroke in its early stage can make a significant difference. But what are the symptoms to look out for? The signs of a stroke can vary, but there are some key symptoms that you should know. One of the most common signs of a stroke is trouble with speaking and understanding. This can present in different ways, such as slurred speech, difficulty finding the right words, or even confusion in conversation. It's as if the words are on the tip of your tongue, but they just won't come out right. Or you might find that what others are saying to you doesn't make sense, like they're speaking a foreign language. Another common symptom is paralysis or numbness of the face, arm, or leg, typically on one side of the body. This can be a sudden loss of strength, leading to an inability to lift an arm, a drooping face, or even a sudden fall. It's as if one side of your body has suddenly decided not to cooperate. Trouble with seeing in one or both eyes is also a symptom of a stroke. This can manifest as blurred or double vision or even a sudden loss of sight. Imagine being fine one moment, then the next. It's as if someone has dimmed the lights or pulled a curtain over your eyes. You might also experience a severe headache, often described as the worst headache of your life, that comes on suddenly. It's not like your regular tension headache or even a migraine. This is a headache that can make you feel as if your head is splitting open. Lastly, trouble with walking can be a symptom of a stroke. This could present as a sudden loss of balance or coordination, or an unexplained dizziness. It's as if the ground beneath you is shifting, making it difficult to stand or walk. These symptoms are serious and require immediate medical attention. Time is of the essence when it comes to a stroke, and every second counts. Remember, spotting these symptoms early could save a life. There's a handy acronym to help remember the symptoms of a stroke: FAST. This four-letter word stands for face, arm, speech, and time. Let's delve into each of these components so you can recognize the signs and act swiftly, potentially saving a life. First up, we have face. This refers to facial drooping, a classic symptom of stroke. If you notice one side of someone's face drooping or numb, it's time to suspect a stroke. An uneven smile or a face that seems off can be a clear indication of something serious. Next, arm. Arm weakness or numbness is another common symptom of stroke. The person may have trouble lifting one or both arms, or they might complain that their arm feels heavy or numb. If you see this, it's another red flag. Then we have speech. Stroke can affect a person's ability to speak clearly. Their words may be slurred or they might have trouble speaking at all. They might also be confused, finding it difficult to understand what others are saying. So, if someone's speech suddenly becomes unclear or they're struggling to communicate, consider it a warning sign. Finally, the T in FAST stands for time. And time is absolutely of the essence when it comes to strokes. Every minute counts. If you spot any of these symptoms, face drooping, arm weakness, or speech difficulty, it's time to call emergency services immediately. Don't wait, don't second guess, just dial your local emergency number. Remembering FAST could be the difference between life and death, between full recovery and long-term disability. The quicker a stroke is treated, the better the chances of reducing damage to the brain and achieving a successful recovery. Also, it's important to note that these symptoms can occur individually or together. Even if only one symptom is present, it's still crucial to act fast and get medical help. So, let's recap. Face, arm, speech, time, FAST. It's a quick, easy way to remember the signs of a stroke and the urgent need for immediate action. Don't forget FAST, it could make all the difference. Why is time so crucial when dealing with a potential stroke? Pause for a moment and think about this question. The answer lies in the very nature of a stroke itself. A stroke is a sudden interruption in the blood supply to the brain. It's like a ticking time bomb, and every passing second can mean the difference between a full recovery and irreversible damage. When a stroke occurs, it's as if a roadblock has abruptly appeared in the highway of your brain's blood vessels. This roadblock cuts off the crucial supply of oxygen and nutrients to the brain cells. Without these vital supplies, the brain cells begin to die off rapidly. This is why time is of the essence. Imagine you're in a room rapidly filling with water. The quicker you can get the water out, the less damage there will be. Similarly, the faster the blood flow can be restored in a stroke patient's brain, the less damage there will be. Now let's put this into perspective. Every minute during a stroke, nearly 2 million brain cells die. That's almost the entire population of Nebraska dying off every 60 seconds. The longer the stroke goes untreated, the greater the potential for disability and even death. But here's the silver lining. Immediate action can significantly reduce the brain damage that a stroke can cause. By recognizing the signs of a stroke early and seeking immediate medical attention, you can help save a life, perhaps even your own. Medical professionals have a saying, time is brain. This means quite literally that every second counts when dealing with a stroke. In the race against time, every moment wasted is a moment that could have been used to save brain cells. Remember, a stroke doesn't just impact the individual experiencing it. It affects their family, their friends, their community. It's a ripple effect that can be felt far and wide. A stroke is a medical emergency and every second counts. This is not a mere saying but a stark reality. So let's not waste time, let's act fast and save lives, because when it comes to a stroke, time is indeed brain. Let's recap what we've learned today. A stroke is a serious medical condition that occurs when the blood supply to part of the brain is cut off. It's a critical situation that requires immediate attention. The symptoms of a stroke can be remembered with the acronym FAST: face drooping, arm weakness, speech difficulties, and time to call emergency services. The FAST method is not just a clever wordplay, it's a life-saving tool. It emphasizes the urgency required when dealing with potential strokes. The faster the response, the better the outcome. Remember, time lost is brain lost. So it's important to stay alert and aware. Recognize the signs, know the symptoms, and don't hesitate to act. Your swift response could mean the difference between recovery and permanent damage. It could mean the difference between life and death. Stay vigilant, remember the symptoms, and don't hesitate to act. It could save a life.